Have you ever looked at a medical chart and just felt your eyes glaze over? Yeah, me too. Today, we're going to tackle one together. This right here, this dense grid of text, is our map for understanding a really common class of drugs called beta blockers. So, let's dive in.
It sounds like the start of a bad joke, right? But the answer is actually pretty surprising. Both of them can be treated with the exact same type of medication. And that weird connection is our way into understanding how these powerful drugs actually work.
So, how do they do it? To really get it, we're going to start with a super simple analogy. I want you to think of beta blockers as your body's own personal brake pedal.
Okay, so at their core, beta blockers are all about giving your heart a bit of a break. They're designed to do two main things. They make the heart contract with less force, and they slow down how fast it's beating. Basically, they just reduce the heart's overall workload. Think of it like this. When you're stressed out, or maybe exercising, your body floors the gas pedal by pumping out adrenaline. That's what makes your heart pound. Well, beta blockers act like a brake pedal. They literally get in the way and stop adrenaline from connecting with the receptors in your heart. And the result? Your heart calms down, your heart rate slows, and your blood pressure drops. Now, of course, it's not quite as simple as having just one brake pedal. Just like cars have different kinds of brakes, beta blockers come in different flavors. Let's take a look at the two main types you need to know about. And if we go back to our chart, you can see it's broken down into these sections with all these drug names. Don't even worry about memorizing them. We're just going to focus on the main difference right at the top that organizes this whole thing. The entire thing really comes down to these two words, cardioselective and non-selective. And believe me, this distinction is absolutely crucial. It's what helps a doctor decide which drug is right, and more importantly, which one is safe for a specific patient.
To make this crystal clear, let's use one more analogy. Imagine your body has all these locks on it. Those are the adrenaline receptors. A beta blocker is the key. But the big question is it a master key, or is it just a key to one specific room? So here's how that plays out. A non-selective beta blocker, that's our master key. It fits locks all over the body. In the heart, sure, but also in the lungs, other organs, everywhere. But a cardioselective one, that's the room key. It's designed to primarily target the locks found in the heart, which are called beta-1 receptors, and it mostly leaves everything else alone.
Now, if we pull up our chart again, we can see this exact principle laid out. See that top section? Those are the cardioselective drugs, our room keys. And right below them, you've got the non-selective drugs, the master keys. This one idea is the main organizing principle for this entire chart.
But, and this is a really important but, there's a catch. Even that very specific room key can start acting like a master key if the dose gets high enough. This means even a cardioselective drug can lose its precision and start affecting other parts of the body. It's all about the dose.
All right, enough theory. Let's make this real. To see how this all works in the real world, let's zoom in on one of the most common beta blockers you'll ever see, Metoprolol.
And we're not talking about some obscure medications here. In fact, if you look way over on the right of the chart, you'll see a column that says top 200. 4 of these drugs, including Metoprolol, are so common that they're among the top 200 most prescribed drugs in the entire United States. So let's focus our attention on that single row for Metoprolol. You can see it's listed up in the cardioselective section, which means it's one of our room key examples. Now let's see what the chart tells us about what can happen when you take it and what doctors need to watch out for.
So that primary side effects column for Metoprolol basically translates to a few key things. Patients might feel really tired, get cold hands and feet, or their heart rate might get a little too slow. That's called bradycardia. It can also, in some cases, make heart failure worse. And this last one is critical. It can actually hide the warning signs of low blood sugar, which is a big deal for people with diabetes.
And that's exactly why this key monitoring column is so important. When someone is on this drug, doctors are keeping a close eye on their BP or blood pressure and their HR, heart rate. For diabetics, they're watching blood glucose levels very carefully, and they're always on the lookout for SSHF, that's signs and symptoms of heart failure, just to make sure the medicine is helping, not hurting.
Okay, so we've gone deep into the details. Let's zoom back out for a second. Why does this whole distinction between a master key and a room key matter so much in the real world?
Well, it really all comes down to this. Choosing the right key is everything for patient safety. Giving a patient the wrong key can be really dangerous. It's not just about treating the heart. It's about making sure you don't cause problems somewhere else in the body.
Take a patient with asthma, for instance. Giving them a non-selective master key beta blocker could be a huge risk, right? Because it could also affect receptors in their lungs and make their breathing worse. But a cardioselective room key is usually a much safer bet because it's focused on the heart. That targeted approach is what makes this whole concept so important in medicine. And all of this leaves us with a pretty fascinating question for the future. We've talked about room keys and master keys, but medicine is becoming more and more personal. As we understand our own genetics and biology better, do you think we'll see prescriptions that aren't just for a condition, but are custom-tailored to each person's unique set of biological locks? It's a powerful idea to think about. Thanks for joining me on this tour. Have you ever looked at a medical chart and just